For me, being a physician is synonymous with being an advocate. I think in order to practice good medicine, you have to advocate for your patients. And I think we advocate for our patients all the time, even if we don't name it that. When we get a prior authorization for a medication that's not covered, when we help a patient who's trying to quit cigarette use get connected with the tobacco cessation program, when we get a patient who's uninsured or underinsured connected with better insurance. Those are all forms of advocacy. But I also think advocacy has to extend beyond the patient-provider interaction, beyond the exam room. I think we need to be looking at the larger issues that are impacting our patients' health. And I think we need to use our power and influence as physicians to really try and change some of the systemic inequities that are impacting our patients' health negatively.
We've really purposely designed advocacy education in a way that it will be accessible and available to all residents as they come through the program. During the first year of residency, they will spend 4 weeks in a pediatric advocacy and community medicine rotation. And during the second year, they'll do the exact same thing, another 4 weeks in a pediatric advocacy and community medicine rotation.
The curriculum is actually designed so that each month in their first and their second year will line up with the Idaho legislative session, and they will get the opportunity to take some didactics, some training on things like working with the media, talking to your legislators, testifying in front of a committee on a bill, writing op-eds, things like that. There will also be an opportunity to do a community project, and one of the ideas is that in the first year, the group of residents will decide on an issue that they care about, find a legislator who also cares about that issue, and then hopefully do some background work so that in their second year, they're able to actually put a bill forth that will address that issue and see that bill through the legislative process.
And that is really a unique opportunity and something that we're really lucky to have access to here in Idaho, where our residency is no more than about a 10-minute drive from the Capitol, and where our legislators are fairly uniquely accessible to residents and citizens for conversations and for ideas like this.
You know, there are a wide range of opportunities. We have an incredible group of faculty who have been doing advocacy work for a long time. The idea behind this program is that we really wanted to give residents training that we wanted to have in our own residency experience. We have faculty who are passionate about trauma-informed care, eliminating or changing or at least addressing racism in healthcare, as well as racism in healthcare education. Folks who are committed to gender diverse rights, reproductive rights, climate change and health, a whole wide range of issues. And whatever a resident comes in interested in, we can provide a mentor in that area.